Hi all, I am Sabina, one of the faculties of B-GHUD Nursing Department. Today I am going to start a session that is multiple myeloma. Multiple myeloma or Kahler's disease. What is that? Multiple myeloma. Multiple myeloma means, see, myeloma. Myeloma means abnormal proliferation of plasma cells. Myeloma, it is the abnormal proliferation of plasma cells. See, plasma cells means it's a cell type in WBC. Okay. See, in multiple myeloma, abnormal proliferation of plasma cells, these abnormal plasma cells may produce an abnormal antibody, that is myeloma protein or BJP, Bence-Jones proteins, BJP, in urine and serum. See, in multiple myeloma, here it may decrease the production of immunoglobulins and increase the production of uric acid and calcium. Okay, so multiple myeloma case, plasma cells in the abnormal proliferation aanu. See, plasma cells produce abnormal antibody ke parayna perana BJP, Bence-Jones protein. See, multiple myeloma case, ഒരുപാട് amount calcium and uric acid bloodilekku release ചെയ്യും. Bones ൽ നിന്നും ഒരുപാട് calcium and uric acid bloodilekku release ചെയ്യും. തന്നെയുമല്ല patientന്റെ immunity, that means immunoglobulin, production of immunoglobulin, it may decrease. Okay, what is the exact cause? Exact cause is unknown. Okay, and here the main clinical manifestations. Patient with multiple myeloma, the clinical manifestations are bone pain, that is skeletal pain, mainly towards the ribs, spine and pelvis. And the client is risk for recurrent infection, anemia, thrombocytopenia, increased calcium and uric acid in the blood. That's why risk for getting renal failure. Then BJP, Bence-Jones proteins positive, BJP in urine and serum, thrombocytopenia. That's why risk for bleeding tendency, bleeding from anywhere, like hematuria, hemorrhage, hemarthrosis, gum bleeding, rectal bleeding. So these are the manifestation, along with risk for osteoporosis, pathological fracture. So these are the main clinical manifestations. And here the diagnostic study is bone marrow aspiration. Bone marrow aspiration is the exact diagnostic study for a client with multiple myeloma. And here the management. What is the management of multiple myeloma? Exact management is chemotherapy, radiation therapy and bone marrow transplantation. Okay. Then here one of the important management, that is always hydration status. It's very important. Patient with multiple myeloma, at least 2 liters of fluid per day it is necessary, because for it is the excretion of calcium and uric acid. For the excretion of calcium and uric acid, 2 liters of fluid per day. That means hydration status. And also encourage the client to maintain ambulation. It is also another important point, that is maintain ambulation. Okay, then as a nurse, you should provide anemic precaution. Surely the client is risk for anemia. That's why provide anemic precaution, and folic acid supplements, iron-rich food items are necessary. Then always protect the client from all type of infection. That is neutropenic precautions. Neutropenic precautions are very important. And here as a nurse, you should assess for bleeding. Okay. So monitor the client for bleeding and provide bleeding precautions. Bleeding precautions means mainly safety precautions. Okay, cut short nails, avoid IM injection, avoid aspirin containing medications, always provide soft bristled brushes for brushing, prevent constipation to prevent the rectal bleeding. Like of bleeding precaution you should provide. Okay, and here always administer bisphosphonate medications. Bisphosphonate medication, that is pamidronate sodium, Zometa. These are the drugs. I think all are clear about this multiple myeloma. Next session we will discuss another one topic. Till that time, bye.